Dr. Manisha. I am from Medical Affairs Division of Lupin. On behalf of my divisional team, I extend a warm welcome to all of you in this brief discussion on patient awareness program for patients of PCOD and mental health diseases. So our team generally brought together distinguished personalities from psychiatrist field and to celebrate this PCOS Awareness Month of September to spread the word from eminent experts. So here joining with me today is Dr. Elsie, and she is working in Kochi, and she's very well-known psychiatrist. Welcome, ma'am.
Good evening, one and all, and thank you for having me here for the interactive session, which will be beneficial for the patients.
Yes, ma'am. Yes. So, ma'am, as we are aware that generally polycystic ovarian disease and mental health illnesses are very closely interlinked. Various studies have been published, and they say that it is quite common in patients with polycystic ovarian diseases, the mental health signs and symptoms, some illnesses or abnormalities. So, how you can associate means, can you throw light on this aspect, how it is associated with each other?
Definitely. The patients who are having PCOS, that is Polycystic Ovarian Syndrome, invariably they'll be having some emotional issues or mental health issues also. There are many reasons for it. See, basically, what happens in PCOS is there will be hormonal imbalance. And because of this hormonal imbalance, there can be a lot of issues the patient facing. For example, there can be hair loss, especially for ladies. If there is a hair fall, then it is having a cosmetic impact on them. So feeling anxious about it or feeling worried about it or feeling sad about it is a very common scenario. And on one side, when we speak about hair loss, on the other side, there is something known as hirsutism, which means hair growth over the face and other parts of the body. And again, it will be too much embarrassing for the young females, and that will affect the body image, and it eventually ends up in the person going into lack of confidence, difficulty in facing others, avoiding social situations, and ultimately leading into a clinical diagnosis of depression, wherein they'll be having sad mood, they'll be having tiredness. Again, the fatigability also can be the part of PCOS. Then lack of interest in doing things. Then again, negative thoughts like there is no point in living, feeling hopeless, feeling worthless. These kind of negative depressive cognitions can be there for females who are having PCOS. The another thing is that there can be inflammation all over the body. Again, the cortisol level, that is a steroid, cortisol level will be high in the body, which ultimately results in one is depression, and again the risk of having diabetes. Again, there are many studies which point out very clearly that there is a link between diabetes and the mood as well. A young female who is having diabetes can end up in having depressed mood, because at the early age they have to start taking medicines and other treatment associated with it. Then other issue is that menstrual dysregularities or menstrual abnormalities. There can be absence of menstruation, or there can be heavy bleeding, again associated with PCOS. All these things can affect the mood of the female patients. Then fertility issue is a major important clinical manifestations of PCOS, wherein the lady will be having anovulation, which means the monthly ovulatory cycles won't be there, and the cycles will be anovulatory cycles, wherein there won't be any production of the ova, which results in infertility conditions, and especially in the background of India, wherein importance of children are very strong and very high, and there is a lot of stigma associated with infertility conditions in females, and especially in our cultural background. So if such ladies are having issues with childbearing, then definitely this also pushes them into a depressed phase. Depression and anxiety, these two conditions are more prevalent in people having PCOS.
Yes. Thank you, ma'am. This is very informative and very important aspect you have highlighted here. So basically, depression and anxiety are common in these patients, but the major issue is also that people find it very difficult to identify and bring it to the notice to their treating physician, gynecologist, or anyone else who is treating that patient. So it often overlooked and left untreated. So in such cases, how you suggest what are these common signs and symptoms that indicate that patient is suffering with some mental health illnesses and he or she needs the support from this for mental health experts. So how you can help us to identify such kind of signs and symptoms to the patients?
Usually, depression and anxiety, it goes undiagnosed until and unless it reaches a severe state, or until and unless it reaches a state that the physician finds it difficult to handle, then they give a cross referral. Till then, it goes undiagnosed. There are certain tips to diagnose how a person, or if a person is having depression or not. Number one is they feel sad most of the time, and they won't be able to enjoy their life. They won't be able to do anything in their life. They'll be having loss of interest in doing things. They won't be having any pleasure in doing things. Then they'll be feeling too much tired. Then they'll have lack of confidence. They'll have poor concentration. They may have sleep disturbances, and sometimes the sleep will be more. There can be variation in appetite also. Sometimes they'll eat more, which means binge eating can be there, or they may have reduced appetite. Then again, the major feature which we usually come up with depression associated with PCOS is loss of libido. They won't be having interest in doing normal, indulging in normal sexual activities. Then there can be lack of self-esteem. Then when the severity goes up, or when the condition becomes more severe, they will think about harming themselves. Then suicidal gestures, suicidal attempts, self-harm behavior, all those things are quite commonly associated with PCOS. Then for anxiety, whenever a patient is feeling anxious, always there will be having some baseline worries. They'll be thinking about or worrying excessively about small things in their life. For example, if the about the health of the partner, or health of the kids, or their own health, then meeting up the demands at workplace, then sleep disturbances, then they may have panic attacks. One may feel that their heart is beating fast, then breathlessness. Then they may feel that something is going wrong in their life. They may feel as if they are going out of control, or they are going to have a heart attack. Such kind of panic cognitions there can be associated with anxiety symptoms. And the major thing is that if you miss out the diagnosis, the quality of life also will be very much affected. Their functioning level will be very much affected. The functioning level usually we assess in their personal life, in their family life, in their occupational place, and also in the social level. So in all these four areas, their functioning level will be affected too much. So if these situations are there in people, and other thing is that again, diabetes is closely associated with PCOS, and there'll be difficulty in controlling the sugar levels even after taking adequate treatment from the physician. So if such case is also there, then we have to suspect that there is an underlying mental health issues which is interfering with the management from the physician's side as well. So if these cases are there, then definitely we have to think in terms of having a serious mental illness or mental health issues in that person, and we have to divert them, or we have to guide them, channelize them to a proper direction, so that they get adequate treatment and best treatment from a psychiatrist.
Yes, ma'am. Yeah. Again, thank you, ma'am. Thank you very much. Very nicely explained these facts and figures. Very, we are thankful. The more thing about that, if such patients are diagnosed with such kind of illnesses or abnormalities or any type of signs and symptoms which are inclined towards mental health disorders, so is there any management or treatment available? And how it is easy to manage such conditions for the patients, that patients will get aware of this management part that it is available? Yes.
Definitely, there are treatments available for any mental health issues for that matter, and especially for depression and anxiety. There are good molecules available, antidepressants available, anxiolytics available, and definitely an experienced psychiatrist can help them out. Usually, it will take a couple of days for them to come out of the symptoms. Initially, what we focus is to make their biological function normal. For example, if sleep is disturbed, to ensure that they're sleeping adequately. So that once the biological functions are normalized, then slowly their mood symptoms or anxiety symptoms, all those things will start settling down. The treatment for depression usually it lasts for, if it's a first episode, then usually it will be nearly for 1 year. And again, it depends upon various aspects also. If it is only because of the PCOS, then depends on how the PCOS management is also going on. Simultaneously, we have to target on both. They have to get treated for the PCOS management, and for example, for their hirsutism, or sometimes they can have acne, or sometimes they can have weight gain. So all these clinical conditions have to be targeted at the same time. Then only the person can have gain confidence about themselves. Then, as per for depression and anxiety, there are other conditions also which can eventually lead a person to have depression. For example, any personal life events or any other personal stressors, then family history, genetic loading, then use of drugs, all these things can have an impact on the mood also of the patient. So considering all these facts, we choose which molecule is needed for a patient. All said and done, good treatment measures are available, and the outcome also is very much promising, so that their quality of life and even the functioning level can be improved remarkably.
Yes, 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 ma'am. So at the end of this session, as we are wrapping up this session, what advice you would like to provide to our viewers, some of them may be the patients of PCOD, on importance of regular mental health checkup and its early detection?
See, whenever somebody is asking the patient to go to a psychiatrist, in an Indian scenario, definitely they'll be having, a big worry in their face. There'll be stigma associated with visiting a psychiatrist. But now things are changing. The medical field has advanced a lot. Then we have to get updated about the treatment available now. My sincere advice is that if anybody is having mental health issues who is hearing me, then no need to wait at all. There is no point in holding stigma. There is no point in holding our old belief systems. Walk to a psychiatrist who can help. She or he they can definitely help you, so that you can have a wonderful life, you can have a stress-free life, you can have a happy life, and you can have a life full of confidence and cheerfulness.
Yes, ma'am. Yeah, thank you. Very nicely explained, ma'am. So, as we came to end of this scientific session, I would like to take a moment to express my heartfelt gratitude to each and every one who has joined this meeting, and also especially Dr. Elsie for giving us a very informative and insightful information to us. Ma'am, sincerely, thank you so much for coming here from your busy practice and giving us these invaluable insights. So we'll thank you, ma'am. Thanks a lot.
Thank you. Thank you.